If you have low back pain, then this video is for you. First, let's go through 3 tissue types that can cause low back pain. The first being the muscular system. You have several layers of muscles that extend from the spine all the way out to the superficial layer. You have deep muscles of the spine that act for stability between the vertebral joints. And then you have other layers of muscles on top of these that act for more movers of the body. Another structure that can cause low back pain is nerves. These structures are deep, and the nerve roots of the lumbar spine exit between the vertebra. If you have decreased space in the foramen here, or if you have an injury that causes a bulging disc, sometimes this can protrude onto the nerve roots, causing you burning, itching, numbness, or tingling down into the lower extremity. This can also be termed sciatica. Lastly, you can also have lumbar spine pain that is due to the joints themselves between the vertebra. Most commonly, you can have facet joint pain, which is this joint that is between the 2 vertebrae on the side. Otherwise, most commonly, you get mobility restrictions between the lumbar spine. So inability to flex or extend the spine due to prolonged immobility. This is something that we work with physical therapy to restore all ranges of motion. As mentioned, one of the 3 areas to focus on in rehab of the lumbar spine pain is mobility. These are several exercises that focus on restoring range of motion of the lumbar spine. This includes flexion, extension, lateral flexion, and rotation. It's important that we restore these mobilities in order to be able to move adequately. Another area to focus on when rehabbing lumbar spine pain is stability. This involves strengthening all of the muscles of the lumbar spine and muscles that surround the lumbar spine so that when you are moving, the core can remain stable. I like to think of stability exercises as keeping the core still while you are moving an extremity or moving the body in a dynamic fashion. The last area to focus on to improve lumbar spine pain is building strength. Strength can involve stability exercises, but they can also involve exercises that challenge the lumbar spine moving through its full range of motion with some resistance. Strength training involves challenging the muscle's ability to produce maximal force. You can do this with a stable core, or you can do this as the core is moving. The key here is to try to work towards increasing the amount of force or weight that you are doing with the exercise. For comprehensive low back pain self-guided programs or for one-on-one virtual training, please visit my website, www.rhpmobilehealth.com, or the link in my bio for these programs.